Roland, what a surprise. The CBO released new numbers of the cost of health care reform. $115 billion is the greater cost of discretionary spending. So now we know health care reform is going to raise costs, raise the deficit, raise the debt, and lower quality. That's what I call winning reform. Winning for conservatives in the fall, that is.
Ah, really? I have something for you, Mary. This is a story dated February 9th, 2005 from the Washington Post. Guess what? In September of 2004, the Bush administration said the prescription drug bill was going to cost $534 billion. 5 months later, the Bush administration said, oops, it's actually going to cost $1.2 trillion. So guess what? Democrats and Republicans do this where they sit here and say one thing and it's another thing. But there's an interesting quote in here. Member of Congress says, those of us who told you it was going to cost twice as much were right. Guess who that was? Congressman Rahm Emanuel. So they all have experience in spending our money as they wish.
You know what? I'm loath to interrupt you, but in the current day, not 2005 or whatever you're reading from, the prescription drug Part D, Medicare Part D, is the only government program in the history of entitlements that's come in over this long run 40% lower than the projection because it's a hybrid program. It has private enterprise and competition in it, none of which are in this health care reform.
No, the point is they told us one thing and there were numbers were revised 5 months later up $700 billion. That's the point I'm making. And so you can dance around it, but Republicans and Democrats spend our money at will.